So, and what do you think is the people's mindset towards health insurance before pandemic and during pandemic? How has the mindset changed towards people towards health insurance?
I've heard a lot of people saying that, sir, the patient, I got admitted, luckily, fifth day, we got all right, we came back. Immediately after coming home, I called the agent and then I booked my policy. There are a lot of people who say that they have understood the importance of insurance, particularly when they hear their friends or their dear ones, getting admitted in ICU for a long time. At one end, they have recovered, but other end, they have to pay a bill of 8 to 10 lakhs. It's a huge amount. They cannot bear that. So all these things makes the family, friends, and all the people associated with the patient to go and get an health insurance policy. So definitely, it has triggered that awareness, but still there should be some form of structured financial support for health, particularly people of the lower socioeconomic class. So economically underprivileged segment in India still requires some financial support. Otherwise, the breadwinner of the family, leave alone this pandemic, if they are diagnosed with a heart disease or a cancer, they don't have money to take care of their health. And what happens to the breadwinner if he's not able to take care of his health? Who is going to save the family? So this is a very critical state. So naturally, there should be some structured financial mechanism to help these people, because all these people cannot go to government hospitals, because we see in government hospitals, the demand is more and the supply is not matching. At the same time, if these people have to go to a private hospital, the cost is prohibitive. They cannot bear the cost. What can a person from economically underprivileged segment can do? When he goes to the government hospital, there's a huge waiting list. But this is a person diagnosed with a single vessel disease and he needs a stent, or a patient diagnosed with a cancer and he is waiting for a surgery. And if he wants to go to a private hospital, the cost is prohibitive. He cannot meet. What can he do? There are a lot of people dying just because they don't get a financial capacity to pay for a dialysis, leave alone heart attack or cancer. I'm talking about a regular dialysis for a month. If they require 12 sittings in a month, that's going to cost close to 15,000-20,000. They don't have that. So in India, the inequality in healthcare has to be addressed. And every growing entrepreneur, every doctor in the making, every medical college should teach the doctors some financial sense. This is very, very important. Without knowing that, whatever knowledge you have, what are you going to do? When you start your practice, you are going to see majority of the patients who are going to count their money when it comes to healthcare expenses. So you have to give them the option which is cost effective. And you have to look out for some model where we can treat majority of patients in India at a very reasonable cost. So this is a message I want to give to the youngsters here. Please look things also at the financial angle, particularly postgraduates. You are already a doctor. So all the more, whether it is available in your syllabus or not, you all should develop that outlook, which is going to help you in a big way.
Very well explained, sir.